Hello, hello, and welcome to the Clear Perspective. It is Alison Lacusier here, and I am here with Dr. Kalli Hale, who I'm so excited to interview today because she is full of knowledge, full of experience, and on a very, very exciting mission. So, welcome to the Clear Perspective,
Oh,
Kalli.
thank you so much. No, it's an honor to be on here. So I really look forward to chatting with you today. And I'm just in awe of what Clearly IG has done for us and our businesses. And it's wonderful to be meeting the girl behind the scenes.
Well, I feel the same about you. I've been stalking you is like probably the best way to say it. I'm just going to be honest. I've been stalking you on social media and just so impressed with everything that you're doing. And like one thing I have to say too is like your authenticity online is amazing. So, we're going to dig into that a little bit, but let me introduce you first. So, Callie is an airway dentist from Texas, and she's from family of dentists, 5 in her immediate family. And she has 3 beautiful children, loves to cook, play the piano, and save lives by catching signs of sleep disordered breathing in children and adults using expansive orthodontics. So she loves what she does, and she's just so honored to be able to help her followers and patients in this way. So welcome to the Clear
Thank you.
Perspective.
Thank you. Thank you so much.
So let me just dig in right away. I want to understand, how did you get into airway?
So I love that question. And it's such a journey for me. You know, getting out of dental school, I started in 2010, which really was not that long ago. And this was not discussed at all. I mean, at all. I went to a very prominent, very large dental school with lots of different residency programs, and sleep was just never discussed, which is shocking to me now, knowing what I know. I'm like, that's actually all we should be talking about, you know? And so I got out of school and I was immediately in my dad's practice. My parents are both dentists, as you mentioned, and I had a job right out of school and I could go in and start learning. And, I did an implant residency actually to learn implantology. And my dad is like a very renowned, wonderful implant dentist. And that just, I loved it, but it wasn't just, my passion like airway is. And I started screening for sleep disorder breathing. I started sending people out. I didn't even have my own machines, and I have so many machines now, but sleep test machines. And we just started screening patients that we were noticing some significant problems in, like grinding and abutment screws breaking, crowns coming loose, like just all these normal things that general dentists are dealing with every single day that we either blame ourselves for, or we just have no idea why it's happening. And I was catching sleep apnea left and right. And then I was like, what do I do? I was like, I don't even know how to help you. Like, you got to go get a CPAP and so I just started screening. The more I screened, the more I realized it was such a vast percentage of our practices. It's like almost everybody, honestly, to some extent. And that's when I realized I needed to learn anything and everything there was to know about it. I don't do anything halfway. And I was like, this is the most incredible. We as dentists hold such an important place in catching this for patients, because we can identify signs in their mouth that they're struggling to breathe at night, with things that symptoms and side effects that we never knew to even correlate to obstructive sleep apnea. And your patients are forever grateful. They're forever grateful. Like, I mean, I can't even count. I've lost count the number of times that a patient's had to tell me, like, why did my dentist have to catch this?
Yeah.
Like, why is that? And I'm like, because we're the best ones to catch it, so anyways, I got educated, and I haven't stopped since that training. And this is all I do. I don't even do general dentistry anymore.
That's incredible. Okay, so there's a couple things I love about this story. One is when you started to notice that there was something happening here, you had the confidence and the initiative and the kind of direction to go and learn more. So tell me a little bit about that, because I know, in dentistry, dentists have so many things on their plate. There's like a plethora of things to solve, problems to look at. What allowed you to really have the confidence and the energy and that decision to go and learn to solve this problem?
So really, my parents, it's actually kind of funny. Like when I was choosing, or even just looking into the different education programs, I was very skeptical about adult expansion, very skeptical, because I got out of dental school and I know everything, right? Like, and my parents actually were the ones that said, look, if this is possible, like you have to do it. Like you have to know about it. Like my dad's been practicing 42 years, and he's like, this has answered so many questions for him in like looking back over all the decades of practice, that he's like, I wish I would have known about this. I wish this would have been talked about. So I think definitely it's a personality thing, because I am very open. I'm very driven. I like to make people, I'm like a provider. Like, I just want to make your day better. I want to make your life better. Like, it's just, so I don't, no two dentists are the same, but any more than, no two people are exactly the same, but I just have a different mindset. Like, anything that's blocking me from my goals, whether it be personal, business, is noise to me, and we need to get rid of the noise and just, I just wanted to do better. And I knew that when I understood things better and knew better, I would do better. And I didn't want my patients to suffer anymore. Like, I think we wait and watch things in every form of medicine that I think we can all do better in.
Mm-hmm.
And especially with the kids. I mean, don't even get me on my soapbox on the kids, or actually maybe get me on the soapbox for kids. I don't know, but we just have to do better. And for me, I was just really driven to be the best provider to my patients that I could be. So
I love that. And that's something like as a professional coach, like I coach people all the time on like how to like take action and get direction. And
awesome.
This is the biggest thing that I think like you've done this so naturally is focus on service. Focus on it gets you out of paralysis. It gets you out of, indecision. It helps you to move forward. So focus on service. How do we be better for our patients? How do we learn the skills and the tools that will help us take that, that to the next level? And it's so cool to hear this kind of legacy that your parents had, and they encouraged that with you, because, I think we've all heard a lot of like, I don't know about airway, a lot of skepticism. And so it's great that your parents were like, yes, go and do this.
Yeah.
So tell
they're just
me,
very forward thinking. So it was like, look, if this is even a thing, like, don't act like you already know about it, because you don't know anything about it. So you should probably go learn about it and then see if it's legitimate, So yeah, just how I was raised.
it's so, so powerful. So tell me, like, what was your first step into the education? Like, where did you start?
Yeah. So I went to a weekend CE course provided by Vivos Therapeutics. It was very early 2019, and they were hosting a weekend course in Houston, and that's where I lived. So I was like, no excuses. Like, if I'm going to get educated, I don't need to go do that there. And I went and I listened, and I was, like I said, I was super skeptical. I was the girl in the front row with a pen and paper and questions and shaking my finger, and just like, I wanted to hear it from the horse's mouth. I wanted to hear it from somebody who had done it successfully long enough that I knew that I wasn't going to hurt anybody, because I was very concerned about that. I'm like, if I'm going to dive in and learn a technique or a procedure, I want to know that it's validated, it's proven, people have done it, nobody's died, nobody's lost teeth, that kind of thing, to make sure. Because I don't know, you've probably seen, there's been a lot of stuff on the media recently over a completely different device, the AGGA device, that is a lot, we don't have to get into too much of it, but what I do is completely different than that. It's different in science, different in the fact that it's removable, gentler, so that was a big thing for me too, when I was learning, because I didn't want to go do something that had the kind of side effects that some of these other things did, period. So
100%.
Yeah.
And so like for the doctors or the team members that are listening that have not like gone down that airway education pathway yet, how does this treatment really differ from traditional orthodontics?
Well, for adults, it's removable, which is key. There's some awesome studies that I was just reading this morning coming out about cyclic loading, and how when you're removing an appliance and putting it back in, which actually I've had training by both Dr. Ben Moralia's course, Airway Health Solutions, and all of Vivos curriculum, which I'm a clinical advisor for them. So I'm teaching this stuff too through them. Those mirror each other so well. Like the cyclic loading and the ability for the PDL to relax in between treatment. You take a tray out if you're doing aligners, you're putting the DNA appliance in or removing it. It's gentler, it's more natural. And the article, which I can send you if anybody asks you about it, talks about how that cyclic loading creates so much more bone growth versus fixated appliances. And I think that's really important as we go forward, that we've got the research to back up our claims.
100%. And I think that helps us be confident with what we'redoing, especially because airway it is newer to dentistry. And it is something that I know a lot of providers are hesitating. They're seeing the signs and symptoms, they're learning about it, but they're like, I don't really know what to do with this.
Yeah.
And so,
yeah, I mean, it's so true. When I lecture, one of the first slides of my lecture is like, how are we supposed to combat this when there's not enough training? And there are so many appliances on the market. Everybody's got their appliance that's their favorite, that it's going to, cure everybody or whatever. And that's really hard for the traditional dentist to figure out and navigate. And the fact is, you know, most don't, they'll just not do it. And that's fine. I always tell them, like, whether you want to treat or not, like, no problem. Like, you love something else, but please screen for it and absolutely refer. Like, what we can't do anymore is miss it. Obviously miss it, and have our patients continue to crack their teeth, break their teeth, need implants, crowns, whatever the thing may be, because an underlying symptom and root cause is not being appropriately identified.
100%. So give me the super fast version of like certain things that people can just start to look for immediately, like after they listen to this podcast.
Absolutely.
Like, okay.
So tooth grinding, bruxism. If your patient's grinding, you need to do a home sleep study or send them out for a sleep study. I don't care, but bruxism is the number one. That's one we see each and every day. The second is tori. So specifically in adults, these are the adult ones: bruxism, tori, and snoring. If you see or they're reporting any of those three things, then 100% they need a sleep study, which you're going to find out is like pretty much everybody in practice. So get a sleep test machine if you want to, so that you can, you know, learn how to use it and all of that. But those are the three biggest things in adults for sure.
Yes, 100%. And what have you seen? Like, tell me some of the stories that you've seen in your patients by, you know, addressing the root cause of what's going on.
It's just, you know, it's nobody has ever hugged me after a filling.
Yeah.
You know, like, they were just happy it didn't hurt as bad as they probably thought it might. You know, this is a completely different side of dentistry. Like, when you get somebody's blood pressure down, I'm using adults as example, like, they don't need blood pressure medication anymore because their heart is not being overworked right before they wake up when they're in REM sleep. When we're talking about the kids, I mean, I could go on and on and on. I mean, when you get a 10-year-old boy to stop wetting the bed, when you get him off ADHD meds, you know, when you have the kid that's been kicked out of multiple schools and now they're thriving, there's nothing more powerful than that. There's not, like, that is, especially in the pediatric realm, a hill I will die on, that we have to stop getting it wrong. Period. Because it's just not okay. It's not okay that 80 to 95% of the population has sleep disorder breathing. It's not okay. And in my opinion, it's because we have been doing things incorrectly in the growth and development and orthodontic space for a century. And I'm not on purpose. Like, I'm not out here just hating on people that do. I'm just, the training that has been available and the way we've been doing it, like, we just have to do better. Tongue ties need to be addressed. Myofunctional therapy and swallowing and like ear infections. And I mean, anyways, there are so many things that I think if we can get some basic screening tools in place to make sure that if, you know, X, Y, or Z is happening, the child is properly referred for either a sleep study or to an airway dentist, we're going to save so many lives.
Ugh, goosebumps for days. I'm just like sitting here having goosebumps. And I agree. I 100% agree with you. Where do you think the future of dentistry is going to go with kind of airway in mind? Like, as you've developed your practice around this, as you've focused on this so much, like, where is the future?
You know, I hope that everything that I'm building with my awesome team is so common that everybody's doing it. I don't know that that's going to happen. You know, my dad jokes that medicine advances one funeral at a time, which is a really horrible thing to think, but it's, you know, it's true in a lot of ways. For me, if we can just save our kids, we're going to make a tremendous impact in the future. So in my opinion, every single child before they are put on medication for ADD or ADHD has a sleep study first. I mean, I go as high as just in legislature, like in schools, we're screening for vision, we're screening for scoliosis, hearing. Okay, that's great. I don't want to stop doing that, but we need to add in an airway screening on all of our kids in school. We need to be looking at crowded arches, overbites. I mean, I have offered in my kids' school, I was like, you just tell me a day of the week, it will take me no time. Every kid that I could just do a very quick assessment, jaw development, What's their occlusion look like, their bite, and refer appropriately to whoever. It doesn't even have to be to me. I don't care. Just to get them the care that they need. So for me, the future of dentistry is that we stop letting so many ailments at the pediatric and adult level. Like, stop letting your patients crack their teeth because they're grinding. Like, there are so many things that and I haven't met a single dentist that hasn't been like, wow, I did not know bruxism was a sign of sleep disordered breathing. Thank you for telling me that. I will now do X, Y, or Z. It's just the lack of awareness. And the more airway dentists like myself, Dr. Hicks, like whoever, like, the more we can grow and educate our community, which is like a huge part of this. I mean, I've done monthly dinners for 2.5 years, and we're going to be doing that for all of our locations. The head doctor is going to host a seminar, teach patients, providers, physicians, teachers, superintendents, whoever will come and listen, because the more that they're aware that there could be something else that we could do, the better we're going to be, because the more the patients are demanding that and asking the right questions, the more the dentists are hopefully going to get trained in it.
100%. The statement that I keep thinking about is, we now know. We
Yes.
now know.
Yes.
And it's one of those things that once you see it, you can't unsee it.
Yeah.
Once you understand it, you can't stop talking about it.
Yeah, it's so true. It's so true.
So in your journey, like on this kind of education path, on building your practice around airway, is there anything that you would have changed or done differently? Or is there anything that you would recommend for somebody that's just starting on this journey?
Yeah, I mean, I don't know that I would say I would change anything in my personal journey, because it's gotten me where I am here and I've loved it. I mean, it's had its ups and downs, but it really required blood, sweat, and tears. And it was like being back in dental school again. I mean, I had to make sacrifices in my availability to my family and my office, and get trained and do things that I needed to do to make sure that I could be the best in the space that I could be. But I think when you're starting out, it's that you need a very comprehensive education. Like, I didn't want to have to go to 4 or 5 different places for these weekend courses to learn something. I wanted a fully comprehensive airway education, which Vivo's had in spades. I mean, it was like 100% that was the route I was going to go. We've been lectured to by sleep physicians, ENTs, cardiology. I mean, it's not just, here's what you can do to teeth, And that was my introduction to Dr. Ben Moralian, who is like, I am just forever grateful. Like, he changed everything for me when I took his pediatric courses and his expansion courses, and we're friends now. And it's like, I'm his stalker. I'm like, what? You think you're stalking me? I'm like, I'm stalking Dr. Moralian. Like, the fact that he knows who I am is just, great. And I want to be that for people. Like, as we've been opening the airway dentist locations, and we've been finding these wonderful dentists that want to learn this, like, so I want to be that person that other mentors have been to me. And because I know that I can't fill the entire need for the entire world. Sometimes I feel like that burden is on me, and it's not. We just need more people that can recognize it and treat it appropriately. And treat it appropriately, that's the linchpin, Allison. Like, that is like, what does that mean? What do you mean treat it appropriately? How are we supposed to do it? And how are we supposed to undo some of the things that we've learned, like, that maybe weren't true or right, exactly the way to do it. So, you need your tribe, and you need good people, and I pick my friends very wisely.
Yeah, 100%. And, anytime that there is a kind of like earth shaking movement, or if there is something that is shifting in industry, and I think airway in many ways it's really redefining what the role of a dentist is and can be. It does take that questioning your own belief system, and it takes questioning everything that you've known. And it's hard. It's really hard.
Oh my gosh, that is so true. Like, and honestly, I think personally, it takes a certain kind of person that's willing to do that. I mean, it's like, who do we hire? What dentist? What are we looking for? What personality assessment? Like, and at the end of the day, it just is going to take the person that's willing to do some internal reflection and say, okay, I've said a couple of things wrong. I've done a couple of things wrong, but now that I know better, I'm ready to do that. Like, whatever is best for the patient, And so, yeah, that's a really hard, if you figure out the perfect cookie cutter personality test to find that, let me know.
Oh my gosh. It's not easy. And I think, like, really it's that person that has the growth mindset, and that is more attached to the outcome and being true and doing good work than ego. And, ego is, I say that with, like, I have ego, everyone has ego, but it's really like allowing that to step aside and be like, okay, I'm admitting that I don't know what I don't know, and I have
Right.
made mistakes, and I am willing to learn and grow and be better because the outcome is what I'm searching for.
Yes, absolutely. 100%.
Tell me about the airway practices.
Yeah, so we are rebranding as the Airway Dentists, and it is a passion project of the dentists in my family, and then our other amazing business partner, Dr. Matt Hicks. And I'm sitting in our Sugarland Airway Dentist location, and we have an amazing dentist here. Her name is Dr. Amanda Aparicio, and she is like just going to be my little mini me, hopefully. I mean, she's doing so well here in these offices have a very specific focus. So I think, as you, I'm sure, have coached others when you are opening a new job, starting a new job, or opening a new business, or whatever it is that you need to have a clear vision and goals for what is the purpose of this project. And for us, it was that we would have a very specific pediatric ortho and airway focus. We also do adult sleep apnea treatments utilizing aligners and expansion and mandibular advancement devices and all of that. But we wanted to have a practice that, we clean teeth, we do some fillings, some very minimal restorative dentistry compared to like my mothership location in Leak City, which is everything from implants to surgery and all that. This was going to be very focused. If we can focus on the patient experience, screening properly, getting the word out, spending time educating our patients, we were going to have a huge impact. And also do appliances and kids and expanders and aligners in a focus that was not just straight teeth. Anybody can straighten teeth, really, if you think about it. But how can we straighten teeth and also help you breathe better at night?
Mm-hmm.
And that's where the Airway Dentist was born, and we just can't wait to see where it takes us, because I think 5 years from now we're going to be like, whoa, what a ride.
Oh my gosh, goosebumps again. And we've had the privilege and the opportunity to work with you guys with the social media aspect of it. And when Matt first told us the idea and he's like, we're opening some practices, this is what we're doing, I was like, yes, this is so fun. And I just want to say, like, the things that you guys have done right is just like incredible branding, modern, beautiful designs, focusing and prioritizing on social media where people are learning and understanding really what is airway dentistry, why does it matter to them, and helping drive, people to comment, when are you opening? When can I come and see you? Even before the practice was open. Like my team.
Literally, we had patients like before we opened. And then oh my gosh, like the first day we saw patients, we probably should have pushed it a week because we were literally still under construction. And this family came in and they were like, we don't care what are you kidding me? Like, we're just happy it was just the craziest. I mean, the benches that we have in the lobby are gorgeous, but they didn't even have fabric on them. Like they were sitting on plywood, you know what I mean? But we were here and she was like, you're who we need. We don't care, So it's just been so humbling. And I'm so blessed to have this life and have the people around me that I do to be able to do this, like most of the time, if you're a dentist, you just, you're chairside all of your career. And I just want to do bigger things.
I love it. I love it so much. And I hope, like, for anybody that's listening, this is an inspiration and also gives you some ideas on how to move that forward. If this is something you're curious about, if this is something that you are seeing, but you don't know what to do yet, there is a path forward. And definitely, I've just put your social media into the comments. Go and please reach out to Kallie. She's on social media. Again, I stalk her all the time. She's giving such great information. But I want to talk a little bit too, because there are like moms that are not even in dentistry that are really interested in airway. And I know like this is what, like when I'm in the social media seat, I'm like, we need to educate our millennial moms because they're the ones that are searching for these answers.
100%. Yeah.
Tell us a little bit about Tooth Pillow, because this is
I was like,
I am so excited.
I know Michelle loves you, by the way. So Tooth Pillow is a huge passion project for me. It's for us to be able to increase the access to care across the United States, because there's just not enough of airway dentists to go around. And we, anybody that is not in my area that wants the treatment that I'm doing and the access to myself and a couple of other phenomenal airway dentists in our company can get screened that way. And they can go to toothpillow.com. They can find out if they qualify. It is like that we are about to launch. And I feel like that's such a huge part of the airway dentist and myself. And there has been literal blood, sweat, and tears over the development of this company over the last 2 years. And it, it never goes fast enough for any of us. All of us at the top are like, what are we? And we are like, it's the tip of the iceberg. So that's great. And I'm so excited to be a part of that and a founder of that, and being able to help people that are so far away from me. And I mean, I've had patients fly to me out of state to see me in League City. And it's like the ability now to branch and help, at all remotely when appropriate is just, I think, where dentistry is going to. You asked earlier, what does that look like? I'm like, teledentistry is a huge part of it. And how can we get more people to have access to cool people? I mean, the fact that I can talk to you right now when you're somewhere else and you're helping us totally remotely for our Airway Dentist locations. And so we talk about that a lot. And the other thing is a podcast that I've started. I don't know, I think maybe that's come across your desk. I don't know, but it's the Sleep Well Journey. So episode 1 is up on the YouTube channel, thesleepwelljourney.com. And it's Kyle and I talking about who are the airway dentists. What are we doing? Why are we in this space? And so those are my big 3 things: is the buildings of these offices, Tooth Pillow, the Sleep Well Journey. I don't know how there's not enough hours in the day really. And I have 3 beautiful kids that need me at home too, but thank you for letting me talk about both those things.
Oh my gosh, absolutely. I mean, this is a very personal conversation for me. I noticed my nephew was, he was grinding his teeth. I heard him at night and I was like, I'm in Alberta and I'm like, where do I find a sleep dentist? I talk to them all the time. I work with them all the time, but where do I find one? And that's why I'm so excited about Tooth Pillow, because I get DMs, I get messages, I get my friends asking me about this all the time.
Viral. Yeah.
And I'm like, I don't know. I know it's a problem. I don't know where to send you.
Yeah. Yeah.
And so
So that's what's great about it is, we right now for our treatment ages, we have it from ages 3 to 12, but there are some that come in that are 10, 11, 12, or even older that we are like, we can still help you, but you need in-person care. And that is, I feel like, gold, because now these patients know that whoever we're recommending, we know that they do things like we do. So building that screen and refer network is going to be huge within that, because now you know where you can go to find the information that you really need, that maybe whoever in your small town or your community or your country, like, I can't wait till we're full, like, launched in Canada. Like, it'll be just fantastic. But anyway, yeah, so I could go on and on about Tooth Pillow.
I mean, it's so exciting. It's really like when you go from being a dentist of a practice and then you think about impacting thousands, this app and this system is going to impact millions. And that's so exciting.
So excited.
I geek out about it so much.
Yeah.
I honestly could talk to you all day. I love that you're such a visionary, such a leader. Like, as much as you have going on, you are so energetic. And I see that with people that are following their passion and they're aligned to their purpose and what they're meant to do in the world. And so it's so inspiring to see. So I want to finish with this question at the end of all of this, at the end of your life. If you could create success, if you looked back and you're like, this is what success really meant to me, what it was all about, what would that look like for you?
That my family just did really, really well, that my kids were happy and they were doing something like I'm doing that gave them the same amount of joy that this gives me. So has nothing to do with, the businesses and all of that. It's that, did I set them up for success like my parents set me up for success? Because they really, really did. My mom had it very, very hard growing up, and she put herself through dental school as a single mom. And it's just like, to me, when earlier when we were talking about, like, how do you have that drive to that personality? It's like, I got that from my mom and my dad. I mean, they were just like, they instilled discipline in me at a very young age. And, like, you didn't get C's, you know what I mean? Like, you're going to do, and my mom always told me, you work hard at the beginning part of your life. You work really, really hard right now so that the rest of your life is so much fun. And oh my gosh, she must have told me that monthly growing up. And now I see it. I'm like, oh my gosh, thank goodness you pushed me, that you, I call her crying from Texas A&M because I'm in undergrad and OChem is too hard, or like whatever. And she was like, no, it's not. You just need to study and you are going to have a great life. You have to put your nose to the grindstone. And I think that was just essential for me. So I just hope to import the same thing for my 3 kids who I adore.
Oh my gosh. I think that this clear perspective has broken the record for the amount of times I got goosebumps on the call.
You're so sweet. Thank you.
It's
Well,
so
maybe we can do this
we
again.
probably need to. I'm gonna come down to Texas and say hi. I need to come and see the businesses, the
Please do. Yes.
offices.
Oh my gosh, you should.
Oh my gosh. Well, thank you so much. I want to acknowledge you for all of the hard work that you're doing in the industry, paving this path and doing it with such joy and energy and enthusiasm. It's just a joy to watch it all grow, watch it all flourish. And if anyone that's watching this has any questions, I put all of the places that you can
Thank
reach
you.
Kallie in the comments. Please reach out to her. And I want to acknowledge you for all the work that you're doing. And thank you so much for being here today to share your message.
My pleasure. I can't wait to meet you in person. And thank you for all the hard work behind the scenes and promoting the airway dentist and everything. I can't imagine not having you guys.
We're so grateful. We love being a part of the mission. So
Thank
have
you.
an amazing rest of your day. Thank you for joining the Clear Perspective, and we'll see you guys next week.
Sounds good.